The Mask Brigade got started on March 21st when Laura, my neighbor, asked one of our Facebook groups, she asked, would anyone be able to make some cloth masks for her hospital? Lots of people wanted to help, and so that's when it started.
The Mask Brigade has tremendously helped all of our frontline workers. I'm sure everybody's seen on the news that there's a shortage of PPE, personal protective equipment, and these masks, they help extend the life of the resources that we do have. We've been wearing cloth masks over top our N95 respirators. Our Mask Brigade has helped thousands of nurses and other frontline workers. We've been able to get a mask to all of the nurses who are working on our coronavirus units at Sumner Regional. We've been able to get masks to all of our environmental services staff at Sumner and at other hospitals like Meharry, St. Thomas West, Centennial, Skyline. So it's had quite a huge reach. When I go and deliver these masks to some of the nurses and techs, they are very well received. There's always big smiles. We have to wear these kind of white hazmat suits, and I imagine to the patients we look like just kind of like little white floating blobs. But having a mask on, it adds a human element to it. It's something the patients can connect with the nurse that's caring for them. So it makes a really scary situation a lot more bearable.
We have made over 3,000 masks as of today. We've had 4,400 masks requested, but that number keeps going up daily. We plan to continue as long as the need is still there.
The process for making masks in our Mask Brigade is a highly coordinated effort. It kind of starts with getting those donations. So we start off with those things, and then we have people that also wash and iron the fabric. And then we have people that are cutting the fabric into the correct sizes based on the patterns that our group is using. And more recently, we've even developed a process where we have an assembly of these already cut fabric and elastic into kits. And then we have those who are our sewers, who complete the masks and then get them to somebody else who does the final wash. They do that final wash and bagging so that those masks are then ready to wear once they get to the healthcare providers.
Participating in this effort has really meant a lot to me. Actually, it's really been an answered prayer, because when I first started seeing on the news the need of all the nurses and the frontline workers, I was just so burdened for them, and I began to pray for them. And I also prayed that if there might be any little thing I might could do, I would love to know what that would be. And the next day I had a phone call about this group. So I have been trying to do what little I can, and it's been a real blessing to me.
Grateful to be on the team with you guys, and I'm also grateful to just be a part of the Mask Brigade and somehow help Frontline, because I worked in the front line for over 30 years and I do not do bedside anymore. So I kind of wish I was out there, but grateful to do that. So thanks.
Anyone who is interested in helping us from Providence Church or anyone beyond the church community is welcome to contact us. We have an email. It's mjmaskbrigade@gmail.com, and that would be a great way to get in touch with us to let us know how you might be willing to help. We'd love to have you. The more the merrier.
Thank you, everyone.
You're our heroes.
You are brave. You are strong. You are known. You are loved.
Woo!